I want to share my story with you. As Anne mentioned, I am the Director of Digital Medicine at Scripps Research and Translational Institute. And Scripps Research has been around and been a part of the San Diego life sciences ecosystem for over a century, from the time that Ellen Browning Scripps funded the Scripps Metabolic Institute in La Jolla to today. Today it is a world-renowned basic science, translational science, drug discovery and development institute, with many, many accolades, including 6 Nobel Prizes, 15 drugs on the market, over 1,000 patents, 50-plus spin-out companies. And we hope to continue to push the boundaries of life science and longevity research for centuries to come. Now, what does this have to do with WellTech and wearables and AI? And allow me to portray this through my own personal journey as a clinician scientist who's kind of gone through this. As a cardiologist, I was trained as a cardiologist. As a cardiologist, I had way too many unfortunate experiences of having to tell somebody that, hey, you have now made your transition from wellness to illness. And more often than not, I would hear a very consistent response. I knew something was off, implying that there was this pre-illness state that really made me intrigued. I would sit there because I felt like many times I would be making medical decisions based on an incomplete picture with snapshots of data. And this is what I wanted to do. I wanted to figure out how can we quantify that pre-disease state and maybe intervene a little bit sooner. And the question at the time was, do we have the right tools to do this? Absolutely. The world of wearable sensors, which Dr. Jacobs mentioned earlier, has evolved. They've been around for decades now. I'm sure a bunch of you are wearing them on your wrist. And they have now evolved into multiple different form factors, covering every part of real estate on our body where we can get a biometric signal of some sort or another, right? So you have contacts that can give you glucose measurements, mouth guards that can give you chemistry, you have necklaces that can give you a blood pressure if you want. But the sad part is that these tools were not given the respect they deserve in the clinical realm for many reasons, because either they were too novel or there was not an infrastructure to ingest that data, or there was just not enough time for us to talk about them in the clinic setting. And this truly became a personal calling for me when, in 2016, I saw my own resting heart rate elevate consistently. I saw my headache counts go up slowly, and there was this imperceptible word-finding difficulty. But it wasn't until I actually had a seizure, and then went to the emergency room, got a CT scan, and had a 4-centimeter golf ball mass on the frontal part of my brain, that I got a diagnosis, and then I could take advantage of the advances of modern medicine, right? And this is how most of medicine is practiced. It's very reactive, very, very reactive. And I, of all people, appreciate the advances of modern medicine. They have allowed us to increase the lifespan of the average American to 78 years. And that's about 20 years more than 100 years ago, by the way. The average health span of the American, health span is a term where you live, the average amount of years that you live without any sort of disability of chronic illness is about 63. So in other words, on average, every American spends about 15 years in ill health. And the question remains, we're living longer, but are we living better? And that health span, lifespan gap has actually been widening over the last couple of years. So have we plateaued in our search for well-being? I don't believe so. In fact, more than ever, we know more about wellness and the 4 foundational pillars of wellness than ever before in history. The 4 foundational pillars that I'm referring to are diet, exercise, sleep, mental health. And there are thousands and thousands of books and podcasts out there for you to read about. I'm just going to plug one because it just came out yesterday. My mentor, Dr. Eric Topol, who is the founder of Scripps Research's Translational Institute, just released a book called Super Agers. It's a fantastic review on evidence-based facts in longevity research. But what I want to talk about is the role of technology in wellness. Because all those activity trackers, all those heart rate trackers, the continuous glucose monitors that you wear, have led to this quantified self-movement that's undeniable. But how do you turn that into actionable data? At Scripps Research, especially in our Translational Institute, we've recognized this for a long time. In fact, back in 2015, we launched a study called mHealth to Stop Strokes study. At the time, we took the most novel wearable sensor that was out there, which was a heart rhythm sensor, wireless heart rhythm sensor called ZeoPatch. We identified individuals who are at risk of having this dangerous heart rhythm called atrial fibrillation that puts you at risk of having strokes. And then we split those individuals into folks where we proactively sent the patches out so that you could monitor yourself at home versus standard of care. And on the right side of the slide, I guess for you on the left, we clearly showed that this proactive approach captured more of this dangerous heart rhythm than standard of care. And that has now evolved into you being able to get a ECG on your watch, most watches do this nowadays, in 30 seconds. Taking a snapshot and you can send it out to your doctor who can tell you whether it's okay or not. And this was back in 2015. All this in an attempt to try to get the bigger picture so we don't have to make decisions based on snapshots. And we continue to push the boundaries of this. In the realm of activity and exercise, those wearable trackers that you wear are not just there to fill the circles or get to your 10,000 steps, right? They have so much more information in them. An example of this is during the pandemic, in February 2020, we launched our Detect study, a Detect platform. And this was before the virus even had a name. And the reason we launched this was to try to understand the symptomatology of COVID. And in 72 hours, we had 35,000 individuals who enrolled. They consented to donate their wearable sensor data, their electronic health records, and also to answer symptom surveys. And within 7 months, we had a manuscript published in Nature Medicine that showed that if you actually took the data from there, specifically if you took your sleep data, your step counts, and your resting heart rate data, and combined it with their symptom survey questions, you could, with confidence, distinguish somebody who was infected with COVID versus another virus, right? Again, we didn't stop there. The goal was to keep pushing the boundaries of what kind of data you can collect in the home. Again, mind you, all of this, all these 35,000 individuals were enrolled at their home. There was no site that they had to come and do anything at. And so again, inspired in the world of sleep science, a state that we spend a third of our lives in, there are more questions than answers. We focus a lot on hours of sleep. And we know that the optimal hours of sleep are between 7 to 8 hours, and every hour below or every hour above that has been shown to be a risk factor for neurodegenerative disease. But there's so much more that our sleep trackers are tracking. Sleep regularity, depth of sleep. Are there digital signatures that can tell us that these individuals with these sleep patterns are at a higher risk of having Alzheimer's? We have an active project looking at that right now. We have another project that's looking at digital wearables. Are they able to actually diagnose obstructive sleep apnea? And we're working with a company, ResMed, local company out of Poway. There we go, on that. And then in the world of maternal health, unfortunately, the United States has some of the worst maternal mortality statistics in comparison to our compatriot countries. And what we are trying to do here is we have a great partnership, a working relationship with Oura Ring. I'm sure a bunch of you are wearing that in the audience as well. They have released a tool around fertility monitoring. But we are trying to find digital signatures for adverse maternal health events. We also have a partnership with Dexcom, another San Diego-based company that creates continuous glucose monitors. I'm sure many of the moms here will remember having to take that horrible tasting liquid to be tested for gestational diabetes. One of the questions that we're asking is, can we replace the oral glucose tolerance test with just a continuous glucose monitor, right? And the answer is yes, we should. The other thing we're trying to do is in the world of mental health, we know that postpartum depression is a real thing. And we know, and we have now actually identified digital biomarkers to identify people who are at risk of postpartum depression, not just stop there, and then see the efficacy of using chatbot therapy to address the concerns they have. Expanding that further, we know that when you hit menopause, there are certain changes that happen that accelerate and make you at risk for having neurodegeneration. It is not a surprise that if you look at patients with Alzheimer's disease, 2/3 of them happen to be women. And so one of the things that we're doing, one of the largest proposals that we're pushing forward is we want to identify what are those changes that are happening and what can we do about them to delay the onset of these symptoms or prevent it entirely. And a moonshot question even further, when we talk about being ambitious and hopeful, why do we accept that menopause happens, right? Is there a way to delay the onset of ovarian failure? These are the questions that we love to answer and noodle about and actually implement on. I'm going to move on to another study that we do, and it's probably our most ambitious one yet, in the realm of diet. Here, we figured if we continue to collect multiple modes of data, dogma around homogeneous syndromes. You know, in the clinic, when I see somebody who's got prediabetes, most people treat prediabetes the same way. Hey, work on your lifestyle, right? There's no granular information provided. But in this particular project, what we did was we took these multiple modes of information, activity tracking, food diary, continuous glucose monitors, genomic data, blood samples, as well as nutrition intake data. And we took it from 500 diabetics and then 500 normals and pre-diabetic folks. And our manuscript just got accepted in Nature Medicine. It's coming out in 2 weeks. We clearly show that prediabetes is not a homogeneous syndrome, that some folks with the same numbers, same glucose numbers, are at significantly higher risk of actually tipping over into diabetes versus others are not. And they should not be treated the same way. The other question that we asked in this one was, for those people who actually wear continuous glucose monitors, why do some people with completely normal, people with no diabetes diagnosis, have the same glycemic patterns or spikes like those with diabetes? Like for me, if I eat a bag of Doritos, my glucose goes to 200. I never thought of that. But the same thing actually happened when I ate carrots. And so everybody's gut microbiome deals with these sort of, with what we give them very, very differently. And again, all of this data that we collect in these multimodal cohorts that we have are trying to find and trying to quantify that pre-disease state. So one natural question that I get all the time is, okay, great, you're collecting these oceans of data. Do you have the capability to analyze it? The answer is, if you asked me this question 5 to 10 years ago, I would say yes, it's a challenge. It's pretty difficult because we have to make sure we standardize and structure that data, but not today. It's not a surprise that in 2024, the Nobel Prizes in physics and chemistry went to the pioneers in the fields of AI, artificial intelligence and machine learning. And it is because we now have the capability of developing algorithms that can ingest mountains of data and are only limited by the data or the data sets they're trained on or the questions you can ask. We are truly in an era of limitless creativity. In fact, just the other day I said, hey, I'm going to ask ChatGPT to draw a picture for me of an astronaut riding a horse on the moon eating pie. And this is what I got, right? In the past, you would not even be able to conceive of a question like this. But imagine translating this into your own health, your own data, your continuous streams of data. Because we usually, when we go to the lab, we get a snapshot. But those biometrics are continuous. All we're looking at is that point in time. Imagine doing that and asking questions about, hey, what is my true risk for certain things, for a certain disease, for a chronic illness of some sort or not? And this is exactly, and we're at Scripps Research, we're doing this for different cohorts and different disease states. And one of the companies that's actually spinning out right now is this company called Nuvi, which we built out in collaboration with San Diego State University's Entrepreneurship Institute. And it's building a conversational AI agent in cardiometabolic disease. And here's a quick snapshot of my discussion with Koa, their agent, their health agent.
Hi, Jay. How's your blood sugar ranging today? I was just reviewing some research about chest pain and blood sugar patterns. This is something we should discuss.
Yeah, I feel like my glycemic spikes have been going up in number, and then my heart rate's getting a little elevated, but the chest pain has disappeared.
There's a little lag.
I'm relieved to hear the chest pain is gone, Jay. Yeah, since we're still seeing those glucose spikes and elevated heart rate, have you been able to track what you're eating and when these spikes happen?
I have been tracking them, and I've kept my diet pretty much under control, but I'll say that my sleep patterns are kind of off. I tend to sleep less than 7 hours a night.
Well, I'm going to cut that short. Basically, I was trying to test it to see, okay, if I give you different forms of data, can you quickly respond to me in an empathetic way and tell me and guide me and help me understand what kind of changes I need to make in my lifestyle? Right? Again, and I apologize if the sound quality wasn't great, but the goal here with these multimodal cohorts, as I said, is to identify that pre-illness state. We don't stop there, though. When we actually identify the chemicals or the processes that become dysfunctional in that pre-illness state, the beauty of working at Scripps Research is that with our basic science tools, we can take it down to its basic structure and then identify therapeutic targets to treat it. And using our Drug Development and Discovery Institute, we can not only develop a new drug, we can repurpose drugs from our 70 billion compound library to see what works against it. And we have done this all in the hope of learning from you, taking it to the bench, taking it to the bedside, and bringing it back to you, so that we can push off the onset of the 4 dark horsemen of healthy aging. And I'm going to give you a few examples of work or active projects that are going on. In the realm of, when I talk about 4 dark horsemen, I'm talking about cardiovascular disease. We are actually actively developing compounds that can heal scarred tissue from things like heart attacks. In cardiometabolic disease, we're developing compounds that are already in trial that mimic caloric restriction, like the GLP-1 drugs that are rampant in society today, without having to take them forever. Then in the world of Alzheimer's disease, we've got compounds that are boosting the immune system to protect it against brain inflammation, which is a risk factor for actually developing Alzheimer's disease. And one that I'm personally very excited about, beyond all the therapeutics that we've developed in cancer, is this whole idea of digital twins in oncology, so that we can understand the natural progression of different tumors from data collected from your own data, not necessarily data collected from a population, so that I can actually ultimately answer the question in an informed way that haunts most cancer survivors: will my tumor come back? And when it does, what can I do about it? Right? All of this is a team effort, And I want to thank all my collaborators, friends and mentors from Scripps Research and Scripps Research Translational Institute. And I want to leave you with this quote by Marie Curie. "Nothing in life is to be feared. It is only to be understood. And now is the time to understand more so that we may fear less." So please stay curious, support the science, and keep moving in our beautiful city. Thank you.